Speak to Fred Roeder, who's a health economist and the Managing Director of the Consumer Choice Centre. Joins me now live from London. Good to have you with us. The WHO has been criticised for its delay in declaring coronavirus a public health emergency, for praising China's response to the pandemic. Do you think those are fair criticisms?
Unfortunately, they are fair criticisms. Don't get me wrong, I think it's extremely important to have a global response body that coordinates all countries of the world when a crisis and an international pandemic like the coronavirus emerges. We've seen this in 2014 during the Ebola crisis, that the WHO was way too late to respond. There were many investigations afterwards to make the World Health Organization fit to finally be able to respond quickly enough. What we can see now, actually, is that despite Taiwan already warned the world in late December 2019 that the coronavirus is transmissible from human to human, even on January 19th, 2020, the WHO still said it's very unlikely that humans can infect other humans with COVID-19. Obviously, this was wrong. It's also, in general, very, very unfortunate that the WHO just plays according to whatever the Communist Party in Beijing wants the WHO to do. So very scientific evidence from Taiwan, for instance, being ignored because Taiwan is not being seen as a full member. So while I don't agree with everything Donald Trump does, and definitely the United States made their own mistakes by not being able to roll out testing quickly enough, the decision to finally say enough is enough, the World Health Organization continuously fails. We need to stop wasting taxpayers' money on this.
Well, hang on. I mean, if you're saying that the WHO is not an efficient organisation and President Trump's response is to cut funding to it, how does cutting funding make it a more efficient organisation?
Yes. So there has been the attempt for the last 7 to 8 years to reform the WHO, which has failed. The WHO spends more money on travel than on global crisis response. They spend more money on travel and fancy hotels and first-class flights than on fighting HIV, Ebola, and tuberculosis combined. And again, this time, the WHO costed us at least 4 to 6 weeks of responding earlier to COVID-19. So we cannot solve the problems with COVID-19 now or the shortcomings of the WHO. But moving forward, we need to reinvest this money in a global public health crisis emergency response organization that is actually not just doing political games following whatever comes out of Beijing, but we need to have an organization that is actually interested in the public health of the world.
I mean, the WHO, of course, completely refutes that it's in any way influenced by what comes out of Beijing. And regardless, the WHO's role is a lot greater than just responding to a global pandemic. I mean, part of its job is to strengthen health systems in poorer countries, for example, or make governments prioritise healthcare. So it has a raft of jobs. If not the WHO, then who is going to take on that job?
I just give you an example. I mean, there used to be the League of Nations. It failed, and the UN was created. And maybe now we're at a time where, unfortunately, the WHO is not capable of doing this because it's one country, one vote. And unfortunately, most members of the WHO are not liberal democracies, but they have their political games in place. I mean, Tedros Adhanom, the Director General of the WHO, is like a self-proclaimed Marxist. And apparently hiding information is what also Communist China does, ignoring evidence when it's from Taiwan because they just did not want to see Taiwan as a country. I mean, there was this high-level WHO official who just stopped an interview. It was a Canadian national who stopped an interview just because the name Taiwan got mentioned. If we look at the recommendation of the WHO that face masks, for instance, are not a suitable tool to contain the disease or to slow its spread, it turned out this was totally wrong advice. And countries like South Korea, Hong Kong, or Taiwan ignored this advice from the WHO, and they were much better in slowing down and flattening the curve than, unfortunately, Western countries, which believe the WHO, which now costed thousands of lives.
Fred, thank you very much indeed for joining us. Fred Roeder there.